Another video to update you on the current topics surrounding the coronavirus. The current death toll in England has reached just over 1,650 as the NHS struggles to cope with the rising number of cases. Today we have Rob Miller, who is the director of the Cuba Solidarity campaign, who will be giving us an insight into how this pandemic has impacted countries in the Caribbean, such as Cuba. To start off with, I want to mention that our community has always had a keen interest in the developments in Cuba. And so we would like to know what the current situation is like following the coronavirus outbreak and how they are responding to it.
Hi, Alina. Hi. Yeah, so Cuba has suffered from the pandemic like many other countries. I think the current numbers are around 5 dead in Cuba, and around 130 people have been infected, although those figures are changing all the time. But Cuba has a very well-developed health service, particularly in primary care. And they have many doctors, the highest number of doctors per population in the world. And the doctors and also medical students are going door to door through the family doctor program to check up on everybody to make sure that the whole population is carrying out social distancing like ourselves. In Cuba, the hotels, restaurants, the shops are all closed. Everyone is wearing nasbucos, which are face masks, which are difficult to come by, but in Cuba they have a national program for people to make their own face masks, and they've been sewing face masks out of old clothes and t-shirts and so on. The schools are all closed, as I said. So Cuba is very well prepared for such a health emergency, and they are doing everything to protect their own population. They have isolation centers in each of the 19 provinces and designated hospitals. So we're very, very hopeful that Cuba will be able to contain the virus within Cuba, within its own borders. They have a very well developed health service, and a number of medicines that are used have been used in China successfully to treat some of the patients who have been suffering from coronavirus.
That's perfect. So that leads me on to my next question I was actually going to ask you. So there have been there's been a lot of news reports and articles regarding the development of a vaccine in Cuba. And this may be fake, but I do want to ask you if you can confirm if this is fake news or if it's true.
Yeah, it's not. The medicine that you're referring to is interferon alpha 2B, which is actually an antiviral. So it increases the immune system of patients. It's been used for many years. Developed by Cuban scientists. It's been used for many years in other incidences, particularly to combat dengue fever, which is rife within Cuba. But it's been found to work as an antiviral medicine in COVID-19 cases, and it's been produced in a Chinese joint venture in China, and around 1,500 patients who have suffered from coronavirus have been treated successfully with interferon to alpha 2B, and it helps their immune system to fight the virus. So it's not a vaccine as such, but it helps patients. It's actually been requested now by 45 countries around the world, and is being used in all across the globe, including in countries such as Germany, where it's being used, and it's being used in many countries around the world. So it's been an effective medicine, but it's not a virus. It's not a vaccine, sorry.
Okay, so confirm that. So it's not a vaccine, it's a treatment that has been developed in Cuba, however, and is being currently used in China and will be used in other places, hopefully soon.
Exactly.
Great. So similarly, there have been a lot of reports on Cuban doctors being sent out to other countries to help with this situation in other countries. And if this is true, I want to ask you what they are doing well that maybe other countries aren't able to. So I want to ask you about that.
Okay, well, Cuba's got a very long history of internationalism, and particularly of sending doctors around the world. I mean, straight after the revolution in 1959, Cuba sent doctors to Algeria after the revolution in Algeria, and they've sent doctors all across the globe over the last 60 years, most notably in Haiti, following the earthquake to combat the cholera epidemic in Haiti in 2010, following the Pakistani earthquake in Kashmir, in 2005, I think they sent Cuban doctors to the mountains of the Himalayas to treat the victims of the Kashmiri earthquake, and most notably recently in West Africa, where they were asked by the World Health Organization to treat Ebola patients in Liberia and Sierra Leone, and the Cuban medics went there and successfully treated patients in that area. So they have a very, very long history. Thousands of Cuban doctors and medics have traveled around the world. So over 400,000 Cuban medics have been to over 150 countries now in international cooperation missions, but also in emergency relief situations. Right now, 14 countries have Cuban medical brigades. And the most recent ones have traveled even to Europe. There's a most recent one that's arrived in Andorra, on the Spanish-French border, but also to Italy, which is a first to have a Cuban medical brigade coming to Western Europe. But they're also in Jamaica, in Angola, in Nicaragua, in St. Lucia, in many countries, in Belize. Across the globe are Cuban doctors and medics. They have an incredible level of expertise and professionalism, and they have a capacity to get straight into the situation to help patients that need treatment immediately. It's a wonderful thing to see Cuban doctors in their white coats. They are welcomed when they arrive with applause, and people are incredibly grateful to the Cuban doctors when they arrive. And what an achievement for a small developing country under blockade to be able to send doctors around the world like that. It really is a marvelous example of internationalism and solidarity.
I completely agree. So just before we end off, I want to ask you about social distancing and how it's being carried out in Cuba. So in countries like the UK, in America, Spain, you have things like internet, you have affordable internet, you have accessible internet, you have things like Netflix, you have your social media. So it's easy in countries like ours to just stay at home and still be able to talk to your friends. But I know that in Cuba, people rely on social interaction, being able to see their friends and family face to face. So how is it working? How are the dynamics there? Because it's probably...
Cuba has it.
Yeah, no,
okay.
Continue.
Cuba equally has the internet, and they have one of the highest levels of internet access in Latin America. I think they're the third highest now in the region for internet access. So the internet is playing an incredibly important part in Cuba itself, across the entire population, but also obviously TV and radio stations in Cuba are giving out information for people to carry out social distancing, and also the measures that we talked about earlier. Cuba's a very cohesive society. It's a very interrelated society. And of course, Cubans, like many people, like hugs and social interaction, but they are a very cohesive society. Messages travel very, very quickly around the population, and the population and the society, the government, are very linked. So they are able to ensure that everybody understands the best methods of dealing with this pandemic in terms of social distancing, but also in terms of helping each other and looking out for each other to make sure that everybody is looked after, children, adults, and the elderly alike. So Cuba's in a very unique position in that way, with its social infrastructure, its social services, and of course its wonderful health service. And particularly, I think the most important thing is the level of the number of doctors per population. That gives Cuba a unique ability to reach every person on the island and ensure that nobody is left behind.
Thank you so much. That's great information. So I want to thank you for speaking with me today and for giving us all an understanding into how countries like Cuba are dealing with this outbreak. Because it seems.
Can I just say one thing, Alina?
Of course, yeah.
Yeah, there's one thing. The Cuba Solidarity Campaign have launched an online open letter, which has already been signed by around 7,000 people in just 48 hours. And the letter obviously thanks Cuba for its internationalism, but also calls on the British government to press the American government to end the illegal US blockade of Cuba. Because at the moment, the blockade is not only stopping access for the Cuban health service, for the medicines and the equipment they need for their own population, but it's also hindering the world in its ability to be able to share with Cuba and learn from Cuba in terms of how we deal with this worldwide pandemic. So people can sign that open letter, and we'd really appreciate it if some people did, at www.cuba-solidarity.org.uk. Thank you very much.
Thank you. I'm sure people will sign up. So I want to thank you again, and I want to say I hope everyone has a lovely evening. So stay safe and stay at home.